everybody. Welcome back to Psychedelics Today. This is Joe Moore, joined by Melissa Lavasani from the Psychedelic Medicine Coalition, and you're the executive director over there. And I guess disclosure, I'm a board member, everybody. So I'm really happy that we get to do this, and just I'm going to be really pro Psychedelic Medicine Coalition. So let's dig into it. We've had you on before, Melissa. Thanks for joining us again. How's your day going?
Yes. Thank you for having me. It's going great.
Good.
At the end of the week, it feels good.
Outstanding. Yeah. So you guys had a bunch of news recently. There was a PAC announcement that I'm sure we're going to get into a little bit. But I guess for those who aren't familiar with your work, can you give us a little bit of background on you and PMC?
Yeah. So prior to founding PMC, I ran Decriminalize Nature DC in 2020. That we did that campaign based on my personal story of healing, being a working mother in Washington, D.C. I was working in local D.C. government, working budget and policy for the city of Washington, D.C. I was grappling with terrible postpartum depression. The healthcare system was not providing me resources that were working. I was very hesitant of getting on antidepressants. I've had 2 friends now take their lives while on antidepressants. At the time, I had a lot of paranoia about getting on that kind of drug while I was in the state that I was in. I had no idea what the end result would have been. So I went about it. I went rogue and went to the underground. I started growing mushrooms in my bedroom and started with microdosing. I'd never tried a psychedelic before in my life, but, I dipped my toes with the microdosing. I found immediate effects of that. I'd engaged with my children for the first time in many years, and with my son for really the first time since he was born. So that was a really mind-blowing experience of, taking something for only a few days and feeling my humanity come back again. So I did a deep dive into the long history of psychedelics within American society, and I have found the amazing research institutions that were researching these substances, and I felt very compelled to try to make a difference in this world. I felt like I'm a good messenger for this. I've not been a lifelong user of psychedelics, so I can understand people who have no experience with these drugs. Personally, I understand what the thinking is about these drugs and what some of the preconceived notions are. So I ran that campaign in 2020, in the first year of COVID. It was a crazy experience, but I really found my voice and my passion in that campaign and turned that into creating Psychedelic Medicine Coalition. I learned a lot about the space. I learned a lot about myself. I learned a lot about what the trajectory of psychedelics could potentially look like. And I wanted to make an impact on a federal level. So the coalition is, as a broad base of membership, our goal is to be really as inclusive as possible with the stakeholders in the psychedelic space. But a lot of it right now is really driven by what's going on in the industry with drug development and what this landscape will look like once these drugs start getting approved by the FDA, and who are the stakeholders there, and what can Congress do to make a positive impact on this industry. So, and then, the PAC started a few weeks ago, and we've been off to the races, and that's another really exciting element that we have added to our repertoire, and will be a great tool for anyone who is interested in seeing psychedelic medicines advance within our government.
So let's talk about what a PAC is. I think people might not understand some.
Yeah. A PAC is a political action committee. It is a way to pool dollars from donors, and depending on the structure of your PAC, it depends on what you can spend your money on. So Psychedelic Medicine PAC is a hybrid PAC, meaning it has 2 separate accounts. One that we track and report independent expenditures. Those donations can only go directly to candidates. And then we have the other side of the PAC, which is in the candidate donations, there are limits to how much can be donated. And then the other side, as we can accept unlimited donations and they can go to various things, not directly to candidates, because we don't report those as expenditures, but doing events around candidates, and we're running some polling out of that. We're going to be doing a national messaging campaign where we're educating those who have yet to be touched by psychedelic medicine. So there's a lot of opportunities for engagement with the public and connecting them to elected officials with the PAC. And so it's just approaching this issue from a little different angle. And, I think that people have opinions about money in politics, and um, I have my personal opinion about it, but I have to remain agnostic to this issue because this is the system that we are working in, and for the psychedelic industry, if stakeholders, whatever the ecosystem, however you want to define it, wants to be a player at the table with every other industry, we got to start playing the game that everybody else plays, and putting absolutely money is power with our American government. So, you know, democratizing people that support psychedelic science, and giving them a voice, and that is one way to make us real players in the space. And we've had some elected officials who are already have become champions for this issue within the halls of Congress, who are sticking their neck out on something that is still perceived as pretty controversial within our federal government. You know, we want to be able to support those candidates when they're up for reelection, and support and ensure that they stay in office so they can continue to advance this issue and continue to champion psychedelic medicine within the halls of Congress, and recruit other members to this side. Because being an advocate and taking meetings with Congress is one thing, but to have your colleagues say, this is an issue I'm going to get behind, and I believe this is a really good issue that you should look into and support because it's ultimately helping people. That is very meaningful as well, if not more meaningful than the advocates at times. I think that politicians, they're seen as leaders, but ultimately they're followers. They're followers of whatever issue is going to keep them on track for their ultimate goal. And politicians, being followers, they're going to follow issues that, if their ultimate goal is to stay in office as long as possible, they're going to follow issues that will keep them getting reelected. So I think it's been a long road for psychedelics, and there have been many advocates like Rick Doblin that have been doing this for decades, but it's all coming to a head right now. And I think that using every single tactic we have available is on the table right now, because this is really hard issue to talk about at times with somebody that doesn't quite understand it. And we kind of need to flood them with information about psychedelic science, and be really transparent about what's going on, and what the needs are, and how the federal government can help this issue.
One issue that I recall discussing during the briefing that you had me at in Washington, D.C. somewhat recently, I think was the fact that most money going into this research right now is private, and doesn't necessarily benefit science generally. It benefits a couple private groups, right? And
right.
Private companies can kind of shape their data, but universities, they're just happy to publish, right? Like a lot of researchers,
Right.
once they get funding, they're happy to just write and contribute to the body of scientific literature, and I think really progress things. And so one thing I would love to see is, once funding comes through with PMC, all these new research groups get additional funding, and then we have better unbiased data from more universities.
Yeah.
And I think that's what we need to see, like lots of universities doing this, because even 15 experiments don't really prove much. It's like when you get to the thousands, that's when you're getting like real good stuff.
Well, and also there's just so little known about the brain, period. I think that the way we train medical professionals and, um, you know, everything that goes along with getting a student and turning them into a doctor. It's a very different kind of understanding of our body. It's more of a mechanical function, a cause and effect of what happens. And I think a lot of times trauma and the complexities of trauma are not really, I mean, we're just now dipping into what that impact is on our body. And I think the medical community is just now dipping their toes into this mind body connection. It's becoming less and less of a woo woo topic and more within traditional medical circles. This is being discussed. So yeah, you mentioned our briefing that we just did. The coalition hosted a briefing within the at Congress. It was in the auditorium. There we had a room full of people, an amazing lineup of speakers. The elusive Tim Ferriss showed up via Zoom and discussed his role in psychedelic medicine. He is one of the largest private funders of this space. He's was an integral role in Johns Hopkins psychedelic research and has really been a quiet support system, but also not so quiet. He openly speaks about his experience with his mental health and his, story arc. And it was great to have that side by side with a legend like Rick Doblin, who, is fostering MDMA through clinical trial with the FDA. They're anticipating approval for that within a year or so, hopefully. And then having Matthew Johnson from Johns Hopkins University there discussing, being a recipient of funds that would come from funders like Tim Ferriss, but also being a recipient of federal funding. He kind of, cracked the code with the federal government and got a grant from NIH. And he talked about that and discussed, it took him a couple iterations of a grant application to get that through to the finish line. And, I think this is all well and good. We're so grateful for the private funding that has come to research, and even grateful for the industry folks, the small pharmaceutical companies and the biotech sector for piecing this together and advancing this within, our traditional systems. I think that is really important as well. But understanding that the federal government needs to play a role in this for this to become a public good and not a play for investment. And I think there is opportunities for a lot of money to be made in this. And I remain agnostic to that as well. As long as you're delivering a good and you're not doing harm, have at it. If you've figured out a model that works and you can make money off of that and that's helping people, that's great. But it's on the advocates to ensure that the government is fully aware of what this landscape looks like and how we can shift the priority of it from being either something a wealthy philanthropist wants to fund or out of the goodness of their heart, or and a company wants to advance, and knowing that there's investment dollars and shareholders that they'll have to pay at some point. We need that. The federal funding plays a role in all this, and it should be driving the conversation. It's like the most neutral kind of money you can have, and that it ensures that the end goal is ultimately does this help people and is it safe? And having that federal funding and creating streams of federal funding will ensure that safety and the people that are impacted by this, that are taking these medicines, are doing, engaging in the right kind of therapy. And we're really understanding this issue from the inside out, and not just, how much money an investor can make off of this.
And I like that how you said neutral money, because really it's going to help everybody here. I don't think there's anybody that'll be excluded as a result of increased federal funding. And in fact, it should help everybody from people wanting to use legacy molecules like generation one molecules, for lack of a better term, to people interested in novel molecules. Just understanding the
Yeah.
mechanism of action, the brain science, as you mentioned, like all that's so important, right?
It's critical. It's critical. I mean, and I know there's a lot of criticism about, other drugs that have gotten approved with much less data than psychedelics already has. And um, I hear that argument. However, you know, th- we have to remember why these drugs were put in Schedule One status at the beginning. It was a tool of social control, scheduling these medicines, and um, they carry a heavy, heavy burden on them within the history of the United States. So, um, other drugs that don't have as much data and are approved and are distributed, with the FDA knowing the harms that they cause, that is a much different argument being made. I think that you can't really compare the two situations. The propaganda from the war on drugs runs deep through our veins, and uh, we we have to be willing to do the work to undo that, to be seen as a legitimate industry within our government. So, or a legitimate industry outside of our government, but be willing to do that work within the halls of government. And it's you can argue that it is unnecessary, but it's not. It's absolutely necessary that we undo it, because these issues get politicized really easily. We've seen what's gone on with cannabis, and you know, anecdotally, we know that cannabis isn't as harmful. Scientifically, we know that cannabis isn't as harmful as alcohol, but um, the issue has gotten so muddled in the process and has really become polarized. And I do think it is shifting in a different direction now, but for so many years, it's been really polarized, that we we are losing too many lives, and there is way too much on the line for us to allow that to happen with psychedelics. And these are powerful drugs that can really help people. And we need to think really strategically about how we move forward with this issue in our advocacy, and what we are prioritizing.
So, your original campaign was a decriminalization campaign, and obviously, Psychedelic Medicine Coalition is not that. We're working to raise funds explicitly for science. So, how did you transition? Like, obviously, it's super important that you land somewhere on these questions, but how did you land here?
Yeah. Well, at the time that I decided to do the campaign, um, Denver had just finished their Decriminalize Denver campaign. There was really no other local campaigns that were supporting research. Right now there's multiple states that are state legislatures that are looking at, creating studies and allocating state level funds to research, but none of that was really happening at the time. And on top of that, in DC is an interesting place to get laws passed. We don't have the same authorities that a state has. We are a city, and we are essentially we have congressional oversight over all of our laws. And since cannabis reform, since cannabis was decriminalized in Washington D.C., I think it was 2014. But when it was decriminalized, uh, there was a huge Republican backlash against the city. And, you know, DC has historically been used as a pawn in this Democrat versus Republican battle that's gone on forever in Congress. And because we decriminalized cannabis and move forward with legalization, a member of Congress named Andy Harris, who's from the Eastern Shore of Maryland, so relatively close to DC, but not really. But um, he's a medical doctor. He said that there wasn't enough science to support cannabis reform, that he needed more evidence, and he was going to do everything in his power to stop DC from pursuing further cannabis reforms. So every year since then, there has been a budget rider on the congressional budget that has been passed every year, and it said that DC cannot change any penalties around Schedule One substances, and that was to prevent DC from having. You could grow and gift here, but you can't sell and tax cannabis. So we have a system where we have a completely gray market where you can go to a cannabis store and buy a pair of socks and you get an ounce of weed. And it's like the most expensive pair of socks ever. But like that is how the market has circumvented all this. And DC government, the city's government, and the mayor's office has always kind of understood that they're in a rock and a hard place without being able to tax cannabis, and not being able to actually come down on cannabis because it was so wildly popular here. So we're stuck with this gray market. We can't move forward with creating a legitimate market for cannabis. And this Harris rider that continues to get passed every year and remains a bartering chip for Republicans, really. It impacts any other Schedule One substances. So that's psilocybin mushrooms, LSD, so on and so forth. So when we were doing when we were deciding at like what this campaign would look like, the only thing that we could pursue that would have any kind of meaning was to deprioritize the police within the police department's enforcement priorities, the enforcement of offenses with psychedelic drugs. So, we called it Decriminalize Nature DC, but it really even wasn't decriminalization. It was just a shifting of internal policy within the Metropolitan Police Department.
Was that a break from the traditional Decrim Nature platform?
That was what happened in Denver. So that Denver was actually the first one was deprioritization. It depends city by city. But I believe Oakland was actual decriminalization. And I think that whatever's being pursued around the country right now on local municipalities is actual decriminalization. But there are jurisdictions where you can't do that. And deprioritization is the next best opportunity. So in a way, I knew what we were doing was not full decriminalization, but I felt like I still felt very compelled to talk to the public about my experience with this and talk about, why the laws are the way they are. Because I know I was really surprised when I learned about the war on drugs, and I have a policy background, but that kind of domestic policy was never my focus. So it was really surprising to me how little any of these policies were based on science and data. So I wanted DC voters to understand this issue, that there is potential for there are medicines that exist that are extremely effective and they grow in nature. And, the campaign did a really amazing job. We focused on personal stories and the science behind it. And a lot of people's minds were blown about this history with drugs in the U.S. And, I think people were excited about the potential of psychedelics to heal mental health issues. And remember, 2020 was the first year of COVID. We were entering into completely uncharted waters. Everybody was at their homes. Children were not going to schools here. We had very little human to human contact. I think people were really feeling the first kind of round of the mental health exhaustion that everybody was going through. Um, it was a scary time, and I think that that campaign gave a lot of people hope that there are things out there that people can do to help themselves. Um, so that's why we won by 76%. Like that blew every other ballot initiative that has ever passed in DC out of the water, and it was a noble cause. And I mean, I still think it's somewhat noble to pursue that. But what it resulted in was a lot of various products that were branded really psychedelically and really appealing to that demographic, starting to show up in stores, in all the cannabis stores here in DC. And despite us putting a lot of time and effort into educating people that, this was a decriminalized campaign, this was actually a deprioritizing campaign, people assumed that it was legal to buy, and psychedelic products started flying off the shelf like wildfire. And I had this moment afterwards where I was like, oh God, I have just opened the floodgates for psychedelics in DC. And part of me was like happy about that, but part of me was also really terrified that if a couple of stories come out, like if somebody who isn't prepared for their psychedelic experience, doesn't have the support that they need within that experience, and they, have a really bad trip, have an adverse reaction, they, the worst case, like that story in Miami where a guy took mushrooms and like killed somebody, like a couple of those stories hit, and then the law enforcement comes down with a full swing, and the executive has authority now to say, we are overturning this, drugs are bad, like let's rethink this. And luckily we haven't had very many of I haven't even seen one bad headline from DC, but it's more of how can we get people to safely take psychedelic medicines in a way that is the most helpful to them, and focusing on the data and leaning really hard into the science of this is going to ensure we know exactly what we're taking and why and how much, and this is the container that you need to take it in. There's so many factors for what determines a good or bad psychedelic trip that, and this is a medicine that's different than any other kind of medicine that we take in traditional Western culture. So there's a ton of education that needs to be done about taking psychedelics. I mean, microdosing is like the hot thing right now. I did it. I know tons of people that do it. I feel like we see stories constantly of, like the moms who have put down the wine and are microdosing now, and it's making headlines. But we still don't know definitively if microdosing works, if it's a placebo, what impact that has on our heart, what impact that has on our brain. So, I think that while pursuing the science of psychedelics has become a priority for the coalition and not decriminalization because of this issue, um, it, it will seem like we're taking the long road there. But ultimately, what we're doing is keeping this issue down the middle of the political spectrum and saying, let's explore the science of this. Let's be 100% sure what we're opening up is the right thing for the American people. And, let's kind of flush out what the long-term concerns are before we go full force in one direction and create a lot of polarization against this issue, and really proceed with caution, but ensure that we are still proceeding. Because the biggest argument against cannabis decriminalization has been, well, there's no data. Let me see the data that we should reschedule. We should like what
It's so complicated for so many
that's what
reasons.
members of Congress. Yes, yeah. I mean, it's complicated for so many reasons, but from a member of Congress's perspective, they want to see the data. And who am I to say you don't need that data? Like, that's not my place.
Right.
It's advocates' place to be like, okay, you want to see data? Let's pursue that. And so that is what we're doing with the coalition is keeping lawmakers from swinging from one side to the other on this issue, and keeping it our argument based on facts, and keeping it within the backbone of science. And that doesn't say that indigenous wisdom doesn't matter. That's not what I'm saying at all. I think that there's a lot that we can learn from indigenous use of psychedelics, and the long history that exists there. But I, as an advocate that's speaking to members of Congress, I have to think the way they think and anticipate the information that they want to see, so that this issue will move forward and won't get stuck in this limbo that cannabis is in right now.
So my experience with a couple of those visits we did in the halls of Congress, like even with Republican lawmakers, if you had the right data, they were buying it. It was crazy. I expected
Yes.
really ideological pushback, not based on reason, and I was incredibly surprised. So thank you. Like I actually got hope again, that we can make
Yeah.
like substantial change at the federal level, and this is small potatoes for them, like relative to like their
Yeah.
other asks for money, right?
Oh my gosh. Yeah. Yeah. This is and that's, I feel like you say you're excited. Everyone should be really excited about this. There's to be in really conservative Republican offices in Congress, and you have your messengers there with you, and usually that is a veteran who has served, who has overcome their issues, either be TBI or PTSD or both, and telling their personal stories to these members and their staffers. That is impactful. And it when you make your ask very calculated in that, and you say, hey, I know this is a very politically weighted issue, but all we want is for the US government to explore the science of this and ensure that this is not just, yeah, a play for drug development, and drug development is important, but how do we create a public good with psychedelic medicine and ensure that we're going about advancing policies in the right way? That argument is totally nonpartisan. It's 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 completely logical. And when you're having these conversations, you can almost see their wheels turning with, oh, well, I had, my wife had postpartum, or my brother who served in the Iraq war, came back and wasn't the same person. You can see them catalog through their minds all the people they know who this could have helped. And when you strip it away of this, of what's, the traditional like tactics of activism, where it's very much in your face and demanding the government to do better, and you're failing the people. And it's like, yeah, they can do better, they have failed the people, but when you're in an office and you want to be really effective in changing somebody's heart and mind about this issue, you have to go deeply personal and go in humble and know what your ask is, and make sure that that ask is when it was within their wheelhouse of capabilities. If we all went to these offices after the briefing that we did last month and asked, we're demanding you reschedule magic mushrooms, that conversation would have gone in a completely different direction. Yeah, we would have been, it would have been like, okay, thank you, have a nice day. And we would have been escorted out of the office. But because we're pursuing, and our ask has been research funding, how do we get basic and advanced research funding streams out to stakeholders in this space? Like that is, and not asking for very much money. I mean, we've got multi-trillion-dollar budget for the US government, and asking for 10, 15, 20, even $100 million is really a drop in the bucket for the US government. So keeping your asks measured and really thinking how do we keep this road open in the long term, and thinking strategically that way is going to advance this issue much faster than demanding decriminalization for an issue that really doesn't have a criminal justice element in a similar way that cannabis does. There aren't as many people in prison for offenses around psychedelics as there are with cannabis, and it's not just one demographic of people like it is with cannabis. So even saying decriminalization is important, which it is, nobody should go to jail for these drugs, but you gotta meet people where they are and try to get them to get to your point, but have it be their idea, if that makes sense. I'm not going to demand this from you, but I'm going to provide you an argument and evidence that will lead you to the same conclusion. And that's essentially what we're doing.
And that's what I saw, right? We're
Yeah.
saying, figures from studies from reputable universities, and there's zero pushback. Seeing Matt Johnson talk about the success at Hopkins to one of these people was just like, and watching this person's reaction, it was like saying ghosts are real and I have all the proof. And it was like a really similar reaction. Just it's fascinating. And they care. And what are the things that would be impacted that they care about? VA, cost spent, performance from VA treatments for TBI, PTSD, etc. Smoking cessation, obviously a big deal for all sorts of reasons. Like if we can get people to get less cancer, we're going to be doing a lot better as a culture. And there's just so many things, like the success rate with PTSD alone. And I think, when we can talk about your story as a mom, or like PTSD from like sexual assault history, which is, I think, something that a lot of people can relate to, even in the halls of Congress. They're like, oh, I have sisters and daughters and a wife. Like, this is obviously something I should be thinking about. And, you just kind of like stack them all up and look at all these categories where we could have better performance, less suffering, and maybe, in the long run, cheaper healthcare offerings, right? Because this lowers healthcare costs, like for the whole lifespan of the person.
Oh, yeah. And right now we're just having conversations mainly about mental health. We're talking a little bit about pain. We're talking a little bit about eating disorders, but the focus has just been on mental health. Imagine the kind of impact this space is going to have when you start expanding what we're studying into. I mean, there's already some preliminary studies on autism, but Parkinson's disease, Alzheimer's, these are issues that we really don't have great solutions to right now. It's more of like how you manage this disease versus how you can get mobility back after your stroke. That is really exciting. And I think that once we get a critical mass of lawmakers into this issue, we can start to advocate for those types of things. But it's just building your team of champions right now. If you can do it the right way, these are really great discussions that we can have with members of Congress. And I think when you take the media out of it and you isolate them in a place they feel very safe in their office, and there's no cameras around, and they don't feel the need to get their talking points across, and you have a human-to-human conversation with them about this issue, and the result is that much better, because you isolate all of these external influences that they're constantly under, and you say, listen, I am talking to you as a human being. This was my experience. This is what I did to heal myself. And I love bringing up the amazing institutions that are doing this research, because you do see their face being like, oh, I had no idea Johns Hopkins was looking at psychedelics as a mental health tool, and watching them have their epiphany about this is so fun. And I think that if we can continue to do the work that we're doing, this is going to be one of the issues that's like written in the history books, is like there was bipartisan support and it changed healthcare forever. Like, we have potential to do that. But it's going to be a long road there. And but I think that there's enough good people in the space that are committed to this for the long haul that we will get there eventually. We just have to be really patient.
Yeah, and it's not easy, especially when these psychedelic states can push you to believe some pretty wild things, and have some pretty
Yes.
wild experiences,
Yes.
and then you come back and like, oh, you just had a pure Plato's cave experience, and now you're trying to convince the other people still in the cave, and so it's like a really classic battle, honestly, and it is going to take a long time, and it's so frustrating, right? Like, I think people who are regular listeners to the show will know that I'm no, psychedelic decrim only person. Like, yeah, I love it, but also it's a drop in the bucket in terms of like social suffering that we're trying to address, like when compared to the larger drug war and, racial sentencing disparities and like, it's just such a crazy situation. And yeah, it's tough to have patience in the face of that, but it's also the strategic thing in terms of long-term viability, never getting shut down again. Say we get 10,000 new papers on psychedelics in the next couple of years, like what a great hedge from any kind of crazy clampdown.
Oh God. Yes.
Right.
Yes. And it's hard for me to it's like very much a strange position for me to be in, having run a decrim campaign before and having this change of heart about it. Because in many ways, I was like the people's champion, like the mom who went rogue and it turned out okay. But there's so many factors in my story of why it turned out okay for me. Um, I there's no way to replicate my situation for anybody else. And when you're talking about decriminalizing a drug, for instance, ibogaine, there are certain things about ibogaine that can potentially make it not safe, and there are impacts on the heart that need to be taken into consideration. And if you focus on decriminalizing, which is very much perceived as as a, a step in the process to kind of like bait and switch just to get access for people, um, what you do is you create a marketplace for it. And who has access to these medicines, and who is conducting these under the guise of a ceremony, and who is the expert in this, and who are the facilitators of these medicine, and are we sure that they're the right people for this? Are we sure that they've been trained properly? Like, all of these issues um, were not as prevalent with cannabis. I think with psychedelics, it's you take these drugs and you're in a really vulnerable place, and a lot of bad things can happen. And we've already seen a couple of headlines about that within psychedelic psychotherapy spaces. But enough of these bad instances come out, and enough of media picks up on that, that's going to change the entire narrative of what we're working on. And there's too much on the line for us to let that happen. So while decrim is a nice idea, I think it's important for me as an advocate to be able to adapt and change strategy when I feel like it is important to save the progress that can be made in this space. And that's exactly what happened. I did the campaign. I'm still so proud of it. Like I think it's probably one of my most amazing professional accomplishments ever. But what I learned was, there's another road to get to what we want. A lot of people aren't going to like that. A lot of people do believe that this should just be managed within the community, but I think there's too many factors out of our control to say that that model is going to work in many jurisdictions with the wide variety of people that live in the United States. It's just too risky for us to pursue this as the only policy option, um, especially at the federal level when decrim is so heavily weighted. If we were advocating for federal decriminalization, I feel like I would be doing this for decades and haven't made very much progress on this. It's not an easy argument to make, and it's not just like, oh, the Republicans don't like it. There are a lot of Democrats that don't like it either. So it really is important for us to have those incremental wins in the meantime, and pursuing the science is a way to have incremental wins. And in these discussions where we're just talking about funding for science and research and drug development, like, there are opportunities to educate about um, the issues with inequalities in access. There are opportunities to talk about, like, how much MDMA therapy is going to cost, and what can the federal government do to reduce that cost and ensure there are enough therapists trained and accredited to do this. That those are really big issues that the federal government has to kind of step in and create policies around.
Mm-hmm. Yeah. I We just covered on a podcast that came out today. We're recording on April 7th. A news story in Colorado about Prop 122 and the rural communities in the state feeling bullied by the more urban population centers in Colorado. It's like the Front Range. Yeah. It's like Denver, Boulder versus the rest of the state. And this has been going on for a while here. And just people are so uncomfortable, even with this clinical thing that's going to come in. So yeah, like the science and developing the science is absolutely a hedge over this. Like, as
the same thing happened in Oregon too. When these campaigns win with very small margins, like 1%, 3%, 5%, that means half of the state voted against it. And what that means half the state wasn't being spoken to in these campaigns in the right way. And I'm not criticizing the campaigns at all. I think that, what they did was amazing, but that has been detrimental to Oregon, at least, where the counties opted out.
A lot of them.
And arguably, which could have been a contributing factor to synthesis demise in Oregon. And the investment that they put into some of these rural counties having psilocybin services and that not being an option anymore, like that's something that we all need to consider, is that the US is extremely diverse, and not just racially, but within perspectives that exist in this country. And we cannot just be speaking to one side of this issue. We have to really engage with the public in a meaningful way, and that is speaking to the half of the country that doesn't understand this. And that's kind of the work that I'm excited to do with the PAC, is to be able to speak to those people that haven't yet been spoken to, and or haven't the message of psychedelics hasn't really resonated with them yet, because we haven't been able to convey it in a way that they can relate to. I think that a lot of the psychedelic culture in this country exists on the coast, and there's just this wide expanse in the middle of people who suffer with mental health issues, who suffer with addiction, who suffer with other various issues that psychedelics can help, but haven't quite been able to connect with what's happening the psychedelic space. And that's important because those people vote. And who are they voting for? And what do those politicians want to see happen? So we talk about inclusivity a lot and in the psychedelic space, and this is absolutely, let's be inclusive of people's perspectives that don't quite agree with what's happening in Colorado and Oregon. Let's engage with them. Let's find what their touch points are. Where where can we enter this conversation with psychedelics with them? Is it just addiction? Is it just veterans? Like, okay, let's talk about the impact on veterans. Let's talk about the potential impact on people that are battling addiction. It's not one argument to be made. It's not like fully decrim and access and like, let's make this available to people that need it. There's an urgent need. Yes, of course there's an urgent need, but let's do it in a way that it really sticks. And we have buy-in from various kinds of people. And people are going to vote for elected officials that will advance this issue, and not have it be this kind of siloed perspective on psychedelic medicine.
Um, and this is a bridge, right? So Paul Stamets years ago said, bees are the number one most bipartisan issue in the country. It's fascinating. Yeah. And that it's starting to feel like psychedelics could be the second most. And I don't know if it is, but by any stretch, but it does seem like and there's other benefits too. Like, we can see the opposition as humans when we sit down and have a meaningful conversation and try to find some sort of common ground, right?
Yes.
The way television wants us to act, it's like, oh, everybody who's not you is obviously an evil zombie. And it's not a really sustainable thing for a country, right? So I think this is a really good leverage point into how do we humanize the other.
Yeah. And I think that we've lost sight of that with what's happened with our political landscape in the last 10 years. And we forget that, I live in a very liberal city, and I have so many friends that are like, Republicans are evil. And it's like, not really. Like, in the aggregate, when you put all the messaging together that's coming out, and you're watching our news channels, it's like, yeah, you can come to that conclusion, because that's how some of these news networks make money off of this kind of opposition with each other. And they want us to be going back and forth and yelling at protests at each other. But when you do take a singular person that doesn't share your perspective, if you take them, you separate them from the group, and you have a one-on-one conversation with them, what you find is like, oh, you're way more similar than you are different. And I do think psychedelics is one of the very few issues right now that is bringing together really conservative Republicans with pretty liberal Democrats. I'm working with more Republicans now than I ever have, and I'm a probably center Democrat that I don't lean too far on one side or the other, but I lean definitely more blue. And I'm finding a lot of really amazing relationships right now with Republicans, because they see the writing on the wall with psychedelics, and they've been impacted by some of these issues. People that have lost their children to accidental overdose with fentanyl, and are Republican, but I went through that tragedy, and yearn to turn back the clock and wish that their child could have potentially had access to some of these medicines. So it's really not a political issue, and that's the goal of the coalition, is to never allow it to be reduced to that. Like, let's strip the hype from this and keep this about what it is. And this is about helping people who need help, who are trying their damnedest to go through our healthcare system and cannot find the resources they need that are going to make an impact on their lives in a positive way, that are on this like merry-go-round of addiction or mental health struggles and just are dying to get off, but like don't have the tools to do it. Um, it's really about how, like, I think the most successful advocates are going to be the ones that really reach across the aisle and have human to human connection with some of these people who would normally go against um, some of our ideals. And it's funny. I've become such like a single issue person. I will talk to anybody. It doesn't matter if you want to hear about the science of psychedelics and you want to hear about my story. I will talk to you about it. I don't care, because it's so important to me that um, this doesn't get reduced to like hyped up headlines.
Hmm. Yeah.
Because this it saved my life. It saved my family. I would not be here today. My children would not have a mother. My husband would not have a wife. He would be a widow. I would not be here today if I did not pursue psychedelic healing. Um, I I fully agree with, like, I fully believe that, the road that I was on at the time, I was experiencing suicidal ideation. I felt very dejected from everything else that I tried. My talk therapy was just so not working for me. I was completely disengaged with it. The paranoia I had about antidepressants was reinforced by the just general paranoia I was experiencing with my postpartum depression. And um, I I had convinced myself that my family would be way better off without me. And my husband could move on and marry a woman who loved my children in a way that I couldn't, and everyone would be just better off. So, um, going through an experience like that and making it out and having a policy background like I do and seeing what has happened with other reform movements that are can be similar to psychedelics, and just seeing this is too important to get muddled up with the messy politics. Like, let's keep our focus. Let's keep our eyes on the long term. And what we ultimately want is for people to have safe access to psychedelics, and for this system, that whatever system that's going to be created, like, to have it be affordable for people, to have it be covered by insurance, so people have access to talk therapy, because that's a really critical piece of this. Make sure that the support systems are in place, that um, people can get trained for this within our university systems, within graduate schools. This is a part of our medical training of doctors, and make this as legitimate as possible and above ground as possible. That's how we're going to impact the most amount of people.
Hmm. Yeah. Yeah. And there's an impulse, and we should fight it, folks, to think I'm special because I got access to this before you, and I'm going to gatekeep you. It's like, no, we need to onboard so many people. You're just as special as all of them.
Yes, we're all special. We all have something to provide. I think that, and also, like, healing looks different for different people, and I think community healing is an important one. I know group therapy is going to be something that the industry, psycho, the field, I should say, will adopt. I think there's opportunities with group therapy, but um, community-led healing, that's not for everyone. Um, I I got even within some of the circles that I go in, I am a lot of times the outlier. I think a lot of my girlfriends would not have grown mushrooms in their home, would not have taken a train to New York City to sit in ayahuasca ceremony. Like, I think that I was willing to do that because I was in such a terrible place, and my propensity for risk is maybe a little bit different than theirs is. Um, but I think having psychedelics within a traditional healthcare system only increases opportunities for access. and getting insurance companies involved in that and pharmaceutical companies involved in that, getting them engaged in this is a really important piece. And um, I think we'll see how pharma shows up to this, but um, getting that kind of traditional industry buy-in on this is really critical.
Hmm. Yeah, it's super essential, and it, that is the ballast. If we keep loading that up, we won't backslide as far if there's ever a situation. And that's why I think it's
Right.
so important to have so much science funding, that, science funding like we've never seen before. And let's be clear here, like LSD was the most researched psychiatric or probably drug for a number of years. And it was the treatment of choice for alcoholism in some parts of Canada for a while. Like this is like we've got a lot of really great legacy data, but we need new data to convince policymakers. We need the new universities to, have their rubber stamp on the papers. Like there's a lot that goes on here.
Yeah, they don't want to see 70-year-old data. They want to see, okay, what's latest and greatest, what's happening now, what's happening in the last 10, 20 years with some of these drugs. Um, so in anticipation of that, like let's boost that up and anticipate the questions they're going to ask and advocate for those things before they ask for them. And I think that ensures the safest route towards acceptance of psychedelic medicine within kind of our traditional U.S. infrastructure. It'll be interesting to see how long this takes. I don't like. It's hard to predict uh, how long it takes until people can access affordable psychedelics. But my thinking is, if we can all agree to do this the right way, it'll be much shorter than cannabis.
The less fighting there is, the more efficient we can all be.
Less fighting.
Yeah. And
Yes.
like
Yes.
obviously people in the space know what we're talking about. It's a little outrageous, or actually, no, it's all the way outrageous. Um, and, largely we want the same thing, but we make enemies of each other. And we shouldn't be doing that. We should say, what can we agree upon? Great. Let's try to figure out how to work towards that. Um,
Yeah.
yeah.
Yeah. Operating on a fear doesn't really result in very many good things. I've learned, and that's true across the board. My entire life, I have evidence of every time I've operated out of fear, it never turned out in my favor. Anytime you operate with collaboration and you're you're conveying honesty and you're sharing, and the end result is just going to be that much better. And I think it's the same within the psychedelic space. And I get why people operate out of fear. We're in uncharted territory right now. A psychedelic drug like MDMA, has it ever gone through clinical trial before? Has it ever gotten this far? Um, I think we all don't know what to expect and how the government's going to react, but I think there are ways where we can, um, with the right kind of advocacy, kind of narrow the possibilities. And we forget that the traditional pharmaceutical industry has yet to step in on this issue. I think that they're very closely watching what's going to happen with psychedelics, but they have yet to stick their lobbyists on the hill, and that is the day that I am not looking forward to, because they have one of the most powerful lobbies in the country, and they have budgets for this kind of work in the billions of dollars, really. So how is the psychedelic industry going to compete with that? Well, how you counter that is you educate members of Congress, you educate those influential people before the pharmaceutical industry gets there, so they can't fill their heads with misinformation. They already have the information they need, that they know is factual, that they know is based in science, it's data backed. Um, and that's why this piece of it is so critical. This foundation that we're laying will determine what happens with psychedelics in the future. If we can get to the right people within government and say, this is actually what's going on. This is about helping people and not recreational drug use. And what's going to happen in the 60s is not going to happen again. Make them feel comfortable with this and let them know this is not a play to boost up the counterculture here, which is what they're afraid of, quite honestly, is abuse and losing control um, of people. I think getting them what this is really about will counter the big industry monsters that have yet to enter the room. And this might be a non-issue, but it's really naive to assume that the pharmaceutical space is not going to spend a good amount of money trying to counter this. They'll either buy up companies in the psychedelic space and delay the rollout of products, or they'll send their lobbyists to the Hill and work really hard to undo all this work.
Yeah. Yeah. I think
Because this cuts in their profit structure,
exactly.
right?
So they have to pay attention to risks that might disrupt their
They
profits.
have to
Yeah.
pay attention.
It's their job.
Yeah.
So yeah, like there's so many ways that could roll out. And yeah, you're right. Like we have to pay attention to that. It's coming no matter what. And are they going to be successful? Well, this is their full-time job and they have crazy budgets beyond what any of us can imagine. So it's
Yeah.
yeah.
I mean, my PMC's lobbying team is former pharmaceutical executives, and they talk about the budgets they used to work with to try to get traditional drugs through approved, and it is in the billions of dollars. That's wild. Imagine if like an an advocacy organization like Psychedelic Medicine Coalition had that kind of budget, like the mountains we could move with this. You could run amazing political campaigns in support of psychedelic medicine and really change minds and donate to every single politician through the PAC, and really be effective. But we're not in that place, and we're somewhat in the infancy of this work, and we've got to just like grind and make do with what we have, and be sure that we have some kind of foundation that's laid when the big boys enter the room, essentially. um, I'm not looking forward to it, but also it's a challenge that I'm up for. um, and I think that just doing this kind of engagement early on is just kind of like getting an insurance policy for, like, if there's a drug developer that's like curious about what this advocacy is about, it's really protecting your investment that you have made on the drug development side, and ensuring that there isn't going to be a political blowback on this, because psychedelics absolutely runs the risk of having political blowback. One wrong headline in one person's hands can change everything. So we're at a bit of a touchy time right now, but um, I think that the work that PMC is doing will, and other organizations that are in the space. There's been a lot of really great structures that have come up from the psychedelic space that work in advocacy. I think that uh, what we're doing now is really critical to the future.
And let's name some other stakeholders that would benefit, right? So university research institutions, yet to be formed drug development groups who are working with first generation molecules that are Schedule 1 could really benefit from that.
The public.
Yeah, the public.
Like, I think
Yep.
we have yet to identify indications that, the best, like, let's say you have major depressive disorder, what is the absolute best psychedelic to take given a person's personal history. It's still unsure if the history of schizophrenia is a thing that we really need to be careful of. Like, I think the research community leans on eliminating those kind of people from clinical trials just in case, but we don't know definitively. It could be a case where somebody that has a family history of schizophrenia should not take LSD, for example, but is okay to take MDMA. Like we don't know these
Really basic
things yet.
questions.
Um, it's there's a lot that I think people get really excited when positive studies come out, and it is exciting, but there's still so many questions to this that the research community has that they aren't always outward about vocally, but I know that there are concerns with how we move forward with this. So, you know, our priority is federal funding towards for institutions, but also for drug development. That's critical to opening up access. Um, Creating streams of funding that boost up workforce investment. How can we get universities to understand that this psychedelic assisted therapy is a thing that is coming up in the future, and how do they get center some curriculum around that for students that can work in this field? I think that that's an opportunity as well. So it's and then there are new agencies called like there's a new agency, right, a federal agency called ARPA-H.
I'm
It's
glad you brought that up. I
Advanced
needed to know more
Research
about it.
Projects for Health. Yeah, that is a brand new pot of money that the no one has claimed yet, and the psychedelic space has opportunity to claim some of that. There's people on our government relations team that are working with ARPA-H and building that structure. So feel very fortunate that the space has access to people like that, like true like DC insiders that are putting together government agencies that will have buckets of funding that psychedelic space can access. Like that is, we got to see that as an opportunity. And for a private company, like that is having the ability to get federal funds only increases your value. You don't need to sell to shareholders. You can get an injection of funding in the millions of dollars from the federal government to do the work that you're already doing. Like that's helpful. So the investment community should be paying attention to what's going on in advocacy as well. I think if you have dedicated streams of federal funding, that not only shows that investors in the space that this is a green light from the federal government, but like more traditional investors will be attracted to the psychedelic space, and that means more funding coming in from other sources. So it's really like a small investment in your advocacy multiplies times 100 because it's just unlocks doors. It unlocks the floodgates for federal funding, and we've got a very large budget, and we can have a little piece of it and really change how healthcare looks in this country.
And again, that's one of the big goals we have here is helping healthcare to recover its image. And, these kinds of results are going to be outrageous once they're in the clinical, repertoire. So I'm super excited about that. So Melissa, we're a little over time, but I'm curious what else we might want to shout out before we wrap here.
Yeah, I love to highlight some of the work that the PAC is doing.
Great.
I think, I think this is a way for I've had so many people reach out to me asking how they can help, and the PAC is absolutely a tool for the general public to use their dollars and really become a player in the political influential world, and electing officials that will support this science and really engage with what is going on with our healthcare system is really critical. Doing the Hill advocacy is one thing, but also playing the political game that everybody else plays, and wielding your influence that way is an important piece of this. So, like, we can advocate till we're blue in the face, but if we don't have champions for this issue within the halls of Congress, like it's not going to matter. So, it's really, if you're interested please go check out psychedelicmedicinepac.com. We're just launching now. We are hosting our first event in May in South Florida, and really tapping into the psychedelic culture that's really budding in South Florida. But engaging with people in a different way and having slightly different conversations. Our coalition work is very much government official facing. Our PAC work is very much U.S. citizen, like, we want you engaged in this process. Who you vote for matters. Who's on the ballot really matters. And that, using your dollars to support the candidates that will support psychedelic medicine is one way to wield power, along with voting for the right candidates. So, I think that the PAC is going to be a great tool for us to use in this space, and I'm really excited about that. I think it's going to be really fun. We'll be tabling at Psychedelic Science as well, so I look forward to really engaging with people there. I know that's supposed to be a really big event, and a who's who of psychedelic space, but also like an event that the general public will hopefully be interested in coming and hearing about what the PAC's doing and who we're supporting, and the kind of campaigns we're getting behind. So super excited about that. But that's psychedelicmedicinepac.com. And then, of course, the advocacy work resides within the coalition at psychedelicmedicinecoalition.org. For more information on that, if you have a company or you are a stakeholder in the space and you want to get involved in the advocacy, please reach out to me. We have a lot of work ahead of us, and I think the more allies, the better. And love collaborating with folks in this space. It's such a fascinating field to be in. I'm so grateful to be a part of it.
Yeah. And so, folks, you can do recurring donations at the PMC website. You could do one-time donations. If you're looking to be a member, that would be amazing if you wanted to join as a member and support us at that level. But this work is essential. It will save lives. It will improve the human condition. There's just no way around it. And it's just an amazing hedge, as Melissa indicated, about political whims and large-scale corporate interests. So, this is still really grassroots, and the more science we have, the better for everybody, and it impacts access and much more. So, Melissa, thanks so much for your work. Really excited to be able to help you, and just really hope folks are able to donate a little bit of their time, attention, and resources to PMC and to the PAC. So thanks for being here.
Yeah, thank you for having me.